times academic research develops some very interesting ideas and publishes them in scientific publications, and that's where it stays. And there's a gap between the academia and where industry and medicine can actually utilize this information. And translational research tries to bridge those gaps between the needs of medicine and the information available in academia. And so the Institute really came to kind of sit in that space and bridge all of these ideas. It was founded by Dr. Igor Kohlman, and he really is a visionary in that respect. He knows a lot of people. He is involved in a lot of things in medicine, in science, in business around the world, and he really has his finger on what are the urgent needs of medicine and the technologies that science can use to address those needs.
And you know what, Raichel, there's been over, I guess, the last sort of 20 years through, you know, the use of the internet, is that the public is desperate to be receiving that really up-to-date research. And if it's not provided to them, they will find ways of getting it themselves. So we want to be presenting things as accurately as possible.
Yeah.
Where do you get your, I guess, ideas from in terms of, you know, where your next research is coming from? And when we were talking, you know, a couple of times, we were speaking about sort of unmet needs of women. And I wonder whether you can talk to that.
Sure. So I in thinking about personalized medicine and coming from my field of personalized oncology, specifically where we think about how to treat individual cancer patients, I realized that the doctors and the scientists have, for a long time, you know, trying to make the boxes smaller and smaller. And we sort of skipped over this important characteristic of, is this a male or female body? You know, for a long time, science and medicine said that when they refer to the human body, they refer to the male body. And the female body is a male body with a uterus. But it's really much more complicated than that. And the differences are systemic and fundamental. And coming from personalized medicine, I really felt that there was this huge gap. And, you know, when you say, where do I get my ideas? I almost don't have to do anything, because everyone has ideas and everyone wants to talk about it. And as soon as I started talking about this idea, I was just, you know, there was this waterfall of stories, personal stories that come from real women who are friends, who are colleagues. And I'll just give one example, sort of that happened concurrently with the beginning and the inception of this dream of this center. So I was talking to a woman, and she said, you know, I had the COVID vaccine last week, and this week I started spotting. And I know that I'm not supposed to get my period, and I'm not really sure. It's never happened to me before. And I think it might be connected. And I said, that's really interesting. I've heard that from many other women. And she said, really? Because I talked to my doctor, and my doctor said it's not connected. And I said, that's what everybody else said too. But it took months and months and months of women saying, the COVID vaccine affected my menstrual cycle, and doctors saying it's not related, and Pfizer saying, we don't know, we didn't ask. You know, we tested the vaccine on women, but we didn't ask on the survey, did it affect your menstrual cycle? So we don't know. And after there was just this tsunami of reports from women that it was affecting their menstrual cycle until it just couldn't be denied anymore. And, you know, this idea that women trust their instinct and need to advocate for themselves and to rely, and that science might not recognize or consider exactly what they are, what they're coming to say, you know, until it gets to a point where we just can't deny it.
Yeah. And one of the other things that we were speaking about was this long-standing gender bias in research. And I was saying to you how when I went through medical school, had no idea that most of the sentinel trials that were done were excluding women of childbearing age because of bias. So we have this kind of like, this big hole where we don't have the information potentially.
That's
that
exactly
we need.
right. We talk about how women don't fit the mold because we don't have male bodies, and for a long time, just as you said, the women were excluded from clinical trials. That was really a serious one of the things that led to this gap in science and medicine that we all experience and we all feel and are aware of in our day-to-day lives. There's two main reasons why women were excluded from clinical trials in history. One has to do with this issue of childbearing, that was considered a significant risk factor. Nobody wanted to take responsibility for potentially negatively impacting someone's fertility or someone's fetus. And so they said it's safer just to not include them. And secondly, the point of a clinical trial is to prove the efficacy of a drug or a vaccine or whatever it may be. And, the fluctuations of hormones in women's bodies, the cyclical nature of our bodies makes for complicated data. And I'm not saying that they were trying to commit some kind of fraud, but when you're performing a clinical trial, you want the cleanest and most conclusive data that you can get, and adding extra variables just makes it more fuzzy. And so for those reasons, for a long time, women were excluded from clinical trials, although it is being dealt with. And recently, the National Institute of Health in the United States has put out some very clear guidelines about including women in clinical trials. Another situation that really led to this gap, or that came from being excluded from clinical trials, was a lack of awareness about how women's bodies process and metabolize drugs differently. And a classic example of this is the sleep aid Ambien, where doctors in the emergency room noticed that they were getting a lot of women coming into the emergency room having car accidents the morning after they took Ambien. And what they realized was that the women's bodies were metabolizing the drug more slowly, and they were being overdosed. They were waking up with too much still in their system, and it was impairing their ability to drive. And I'll say that here also, in the cases where clinical data exists, many people have now made a plan to go back to clinical trial data and reanalyze it according to this, with this lens of male versus female. And a third sort of big component to this lack has to do with the way diseases present differently in women's bodies. A classic example is a heart attack. We're all familiar with a movie where somebody clutches their chest and they can't feel their left arm. And that's the way a male body presents an impending heart attack. But a female body presents differently. And people realized that women were being treated too late for heart attacks because the people around them, and even the doctors in the emergency room, weren't realizing that this is what they were suffering from. They were having nausea or jaw pain or back pain, and nobody realized this is a heart attack until it was a little bit too late. So again, there are many institutes and many sort of organizations whose goal now is to get the word out about those type of situations, to learn more about the way diseases present differently in the female body. And all of these things are sort of culling the data that exists, meaning if there are clinical trials, let's go back and look at the data. If there are diseases, if we have these women coming to the doctors, we have records, medical records, let's look back and see what we can learn. But there's still a fundamental gap in the original research, and that's really what we're trying to address here.
Yeah. And Raichel, can you, now that we've kind of like spoken about sort of what the goal is and where the gaps are, can you tell the audience a little bit about some of the amazingly innovative projects that you're working on at the moment?
Sure. So we had this idea for a center, and to kind of work towards these things. And now is a time to mention all of the other people who have worked together with me. I'm very happy to have my colleague, Dr. Yael Mazels, here also on the webinar. She's been by my side from the beginning, from the first idea, and really we've been building this together. Also the head of the Institute, Dr. Igor Kohlman, who supported me and is still supporting me in this work. The administrative manager, Michelle Sosenko, who comes from a business perspective, not from science, but immediately saw the potential and the need for this and has really helped me logistically how to build something like this within the university, and my fantastic research assistants who work with me on my oncology work and have been picking up the slack as I've been picking up projects, and we've been kind of learning together. So as we've been working together to build this, again, I didn't do this by myself and could not do this by myself. We have envisioned sort of 3 stages of how to accomplish this enormous goal. So the first is identifying what are the unmet needs. And we're doing this by talking to people and by listening to all of these stories that people have to tell us. And so we're trying to formalize these unmet needs in a way that they can form a basis for future research. Then the second stage is about performing and facilitating the research. So we have some research that we're performing in-house, and we also have this dream of facilitating research by others around us. And the third stage is about getting the information back out so that the research we do doesn't stay in scientific publications, but it finds its way to doctors, to scientists, to women, to the community, to each on a channel, on a wavelength, in a language that they can understand and internalize and utilize. And so bringing kind of all of these things together, we have tried to develop a kind of holistic approach where we want to look at this issue from a variety of different perspectives. So again, one perspective has to do with collecting information about the unmet needs from doctors and from patients. So I'll just mention some specific projects that we're working on there. With regards to doctors, I know Amanda said to me, how could you possibly catch a doctor and have him sit down and tell you what he thinks about this? They're too busy. And that's a great point. And so we're very lucky to be working on a project together with Professor Barry Kaplan of Ma'ayaneh Yeshua Hospital in Israel. And this project is led by Dr. Yael Mazels. And Professor Kaplan runs several WhatsApp and Telegram groups for communication between doctors and other women's health professionals. And so we've acquired this history of all of the conversations from the group, and we are analyzing from a variety of different perspectives, specifically looking at what are the questions that the doctors are asking, what kind of information are they sharing, who is communicating with who is interacting with whom. You know, a lot of times.
Yeah, and just to pause, just so that people have our audience has an idea, these kind of WhatsApp groups professionally in medicine, I imagine in other areas, are really, really a great source of support for clinicians. But you know, normally it's private. So, you know, when I'm thinking that when COVID started, these groups were just sharing and bouncing off each other. But yeah, this is normally kind of like a private information. So it is amazing that you can have access to it. Yeah, I just want to put a bit of context. Yeah.
Of course, we have the ethical approval, and we, you know, we look at oftentimes before the age of social media, doctors would see other doctors at conferences, and different types of health professionals in a single institution would interact. But the crossover between different types of professionals from different institutions is really unique to social media. And so we're looking at this from a lot of perspectives, but I'll give one example of how we see potential outcome from this research. If we look at the types of questions doctors are asking, for example, a doctor may say, I have this patient, this age, these symptoms, how would you treat, or what dose, etc. There's sort of 2 possibilities. Either the doctors are asking questions for which the answers exist, in which case this is a source of information for seminars or some kind of education that we need to get the information to the doctors. And if the doctors are asking questions for which the information does not yet exist, then it serves as the basis for important and even urgent research projects in the future. So that's kind of where we see that going. I'll talk a little bit about how we gather information from patients and from women. So as I said, we don't have to work too hard. People are sort of knocking down our doors to tell us stories and ask us questions. But we are formalizing it in some questionnaire-based research. And now we've just wrapped up data collection for a really interesting study about the reasons why women use hormonal contraceptives. Now, hormonal contraceptives in history were a fantastic advance for feminism and for a woman's control over her body and for her ability to control her destiny, essentially. But today, the way the interaction between doctor and patient looks is that a woman may go to her gynecologist and say, I have pain during my menstrual cycle, I have heavy bleeding, I have irregular menstruation, I have headaches, I have depression, and that are connected to the cycle. And the doctor will say, take these hormonal contraceptives and it will regulate your cycle. And it does give a sense of cycle, but it's synthetic hormones that are essentially masking whatever hormonal issues are going on. And so the absolute effectiveness of hormonal birth control has actually served as a mask or some kind of band-aid that is hiding our lack of fundamental knowledge of what's causing these symptoms and disruptions in the menstrual cycle. So our study talked to over 600 women that in Israel from all different regions and affiliations. And we gathered information about the reasons why women use hormonal contraceptives, the side effects that they experience. And another very important point is that these women experiencing these symptoms, they also go to other types of professionals beyond their medical doctor. So we ask about what other professionals did you go to talk to about your symptoms? And we found that women go to nutritionists, they go to psychiatrists, physical therapists, acupuncturists, and that leads us into sort of our next big goal. So I'll talk about that in a moment. And this study, we're looking to essentially formalize and publish this essentially list of questions in women's health that we don't have the answer to because they're masked by the synthetic hormones. So speaking about these,
And what themes came up? What sort of themes came up for why women were on the hormones?
Yeah, so we came to about 15% of women who take the hormonal contraceptives not for preventing pregnancy, meaning only for other reasons, but almost, more than 90% take it for multiple reasons. A lot of questions about, a lot of issues about irregular menstrual cycles, heavy bleeding, pain and endometriosis, acne, and all kinds of other reasons. Again, I'm not saying this is a bad thing, but I'm saying we should be aware of what are the reasons. There are cases where hormonal birth control is not an option or not the best option for a given woman. And in that case, it would be nice to have something else to offer.
Yes.
So moving from that, we gathered this list of these, what I call paramedical professionals, who are the professionals who surround the medical doctor and help women, support women who feel that their needs are not fully met by the Western medicine doctor. And those professionals become a repository for all of these women's stories. A woman comes to her physical therapist because she has some issue with her pelvic floor, and she spills out this story that nobody had time to hear. No doctor with their 7 minutes had time to hear. No scientists could translate. And she says, when I was 14, I did this, and the doctor said this, and when I was 18, and when I was 20, and when I had my first baby, and this whole story, that now these professionals become this repository with a wealth of knowledge and real experience and real conclusions. And we'd like to find a way to tap all of that information. So yes, we could sit down and we could interview all of these professionals, but I had this idea, or a dream really, of what I call a research infrastructure. So we at the Institute have a lot of experience performing research, and these professionals are not affiliated with a research institute, but they have ideas, they have information, and they have patience. You know, I'm sitting here in my lab when I want to do a questionnaire-based study, like where do I even start? I walk out the door and hand it to the person in the lab. Now maybe I post it on Facebook, but these professionals have all of the access to all of their patients who fit exactly in the type of research they're trying to do. So we'd like to essentially translate the knowledge and experience of these paramedical professionals by providing them with a sort of a research pipeline where we can work together. We have experience with ethical approval, with study design, with statistical analysis, with scientific publication, and they come with this fantastic information and experience and patient base. And we'd like to work together with these professionals to formalize their experience into scientific publication, which is the language that science and ultimately medicine understands. So that's kind of a big piece of the dream here.
And that was that one of the aspects that I think is so hugely innovative, because we do have the sort of the alternative therapies, you know, the Chinese medicine specialists and the acupuncturists, the osteopaths, that in Western medicine sometimes they don't sort of feel that they're as credible. And part of that is around the fact that they're not publishing a robust research.
Yeah.
And I guess they don't have the infrastructure and the scaffolding to do that. And that's what's so exciting about your project. Yeah. That you're giving them, you'll be giving them the support to do that.
Mm-hmm. I know that in Israel, it's changing a little bit. There is a tide. My sister is a pelvic floor physical therapist in the United States. And she said the hardest part of her job is getting doctors to recommend physical therapy. Once the doctor recommends physical therapy, you know, she's in, she can help. But until somebody says to the patient, this can really help you, someone who the patient trusts says this can really help you, you know, that she doesn't have a foot in the door to help her patients. So this is kind of, we also, is part of our dream of facilitating research. We also have some dreams about providing grants for interdisciplinary research. We can talk about that a little bit towards the end when we talk about our plan for the future. But I will just mention two studies that we're doing here with the resources that we have here in the Institute. So one has to do with data science. We have some very talented data scientists who work in the Personalized Oncology Project. And so when we're thinking about data that exists that can be tapped, we're still working to get this project started, but I really believe that it has a lot of potential. You know, once upon a time, a woman would track her period using pen and paper. And today, many women track their period or their menstrual cycle using an app. And that means that this data exists. If we go back to the example of the COVID vaccine, if we had 100 women, 1,000 women who tracked their period 3 months before and 3 months after they had the COVID vaccine, it's right there, black and white, you know, no more questionnaires and new ethical approval and convincing everyone. It's there, the data exists. And we could look for many, many cases of any types of diseases, drugs, vaccines, early presenting symptoms. Really, the possibilities are endless to tap this data for information that already exists using the really advanced data science capabilities. So we're hoping to work on that. And I'll just mention briefly the project that's really dear to my heart. And I know we spoke about it a lot, but I'll just mention it here briefly. I work specifically in the chemical analysis of biological samples. So I look at what the samples are made of. I look at tissue or blood or urine, what's in it from a chemical standpoint. And I had this idea that we have an untapped biological sample in our menstrual blood. And, you know, this is something that really nobody has looked at. It's a non-invasive sample that women produce every month for most of their life. And I'm sure that it holds a wealth of information for, again, about everything, about every disease, every symptom. Our whole systemic health is there in this sample. So I have this dream of essentially creating a kind of a library and that we can use to study endometriosis, to study gynecological cancers, early detection of ovarian cancer, of uterine cancer, cervical cancer, and really the possibilities are endless. So this is something that we've started here, and I'm really excited about.
And what was fascinating about this is that, you know, we think in the world that everything's been done before, but bizarrely, this hasn't, has it? You know, and you found, you found about like only 40 articles on a PubMed search.
Yeah, that's right. We have there's a database called PubMed that has all of the scientific publications that people have done, you know, in the last 30, 40, 50 years. And so when I first had this idea, I said, you know, like all scientists, probably somebody's thought of it already. And so I searched for menstrual effluent, that's the scientific term, and was rewarded with only 44 articles, which is essentially zero. Meaning, to give one example, if I search for any oncological or cancer-related topic, I'll get tens or hundreds of thousands. And I wanted to sort of just put a spotlight on kind of the ridiculousness of this. And so without being crude, I searched dog feces in PubMed and was rewarded with 6,000 articles about the composition. And so this just really highlights that it just didn't occur to anybody that this might be such a valuable thing. And it's true for this particular case, but it's really true for women's health in general. You know, this is an extreme case, but the distressing truth is that these gaps exist over and over in almost every field. And I always kind of say that as a scientist, it's embarrassing. And as a woman, it's scary. And that was really the motivation for the idea for this center and to create this hub that could centralize. I mean, I'm not saying we're the only ones performing this research. The truth is there's really a lot of great research happening in other places in Israel and around the world. But it's getting people talking to each other and getting the doctors and the scientists talking to each other and listening to the women that's really kind of the motivating factor here.
Yeah, and as you said, all the other health professionals that are not doctors.
Yeah.
And I think probably as women in the audience, I suspect we've all been in the situation where we've been to healthcare professionals and we haven't been listened to. And I think that's where, you know, this kind of focus on listening to women and what they need is remarkable.
That's exactly right.
Raichel, tell me about what the plans for kind of the next couple of years are, and then we'll open up for questions.
Sure. So as I said, we're really looking for interdisciplinary approaches, and that means interdisciplinary between different departments within Ariel University. It means collaborating with doctors and hospitals around Israel. It also means, you know, we don't have to do everything ourselves. We're happy also to be, as I said, a place where doctors and researchers can come to meet each other and find collaborators affiliate with us and use their skills and their knowledge to perform their research. We're not trying to do everything ourselves. We'd also really like to be able to facilitate this research, both by this research infrastructure that I talked about, and also by giving grants. We'd like to be able to offer starting seed grants to people who are interested in performing this type of research and remaining affiliated with the center. We'd like to have that as part of our, putting our influence out there, promoting this work to move faster with all of the possible resources, with our research resources, with our networking resources, with our financial resources. And we'd like to educate, to get the information out. So we'd like to host conferences for doctors and for scientists, and also seminars for students. Ariel University recently opened the medical school. We have a couple of medical students working with us on some of our projects, and we hope that that will grow. And we'd like to have seminars for the doctors so that we can really, for the medical students, so that we can really be cultivating the next generation of doctors and sort of getting in at the roots and really looking towards the future, and to recognize that we're part of this modern world, to also be communicating via social media and conventional media outputs to make sure, like I said, that the information that we have here doesn't stay here, but gets to women, helps women have access to the proper healthcare, good quality of life, helps women feel confident and advocate for themselves, feel like they're being listened to. And that's really what we're trying to do, to be a place that listens. And I really just want to say that I appreciate so much the Australian Friends of Ariel University, both for the invitation to speak and also for all of their support and enthusiasm. It gives more motivation and more koach, as we say, to keep moving, to keep working, to gather together as many resources as we can. We really believe this is important, and we're seeing our dream come true here. So it's really amazing.
Well, I suppose, Raichel, that's what I guess your enthusiasm and your passion is what's being picked up and noted. Because I think, at this time, there's a lot of people that, a lot of areas in universities and research where people are just tired. And also the COVID focus, yes, we're in a pandemic and it's been 2 years, but then now we need to move on. And there's other issues other than COVID. It's about, I think, also sort of opening things up a little bit wider. What we might do now is just open up to the audience to see if anyone has any questions for Raichel. Just while we're doing that, I just noted Naomi asked a question around research at the Institute around domestic abuse. And I answered that I didn't think that was not your department. But yeah.
We don't currently have projects. There are some really great many other institutions in Israel, and I can think of a few. If you're interested, I'm happy to mention them or send you a list of people who are doing that type of research in Israel. And we have some sort of sociology-based projects, but we're hoping to use them to feed our biology or medical approach. But there's definitely some great institutions in Israel doing that kind of work. I also have a question here from Ilana. She said, if we're analyzing menstrual blood, will there be inroads into working out different doses of medication and treatments based on hormonal stage? So I think this really highlights, when we talk about personalized medicine, how much information there is to gain from this sample. I have this dream, the way that we go to the doctor's office to give a urine sample or a blood sample, that a woman could go on the first day of her period and do some kind of swab, and it could be used for diagnosis. Or potentially, I think you're alluding here that the way we metabolize medicine might not just be different from men, but it might be different from ourselves at different stages of life or different parts of the cycle. And I think that interplay between cycles and disease, cycles and medication is a fascinating and enormously overwhelming topic. But if all the scientists of history were too scared to touch it, let's try.
Yes. Yeah, it's fantastic. It's just an untapped area, isn't it? Yeah. Amanda Shapiro would like to know, Raichel, if Ariel has any collaborations with Australian research institutions.
So I know Yael is here. I don't know. Maybe she wants to mention. I know the personalized oncology team is in talks with a pediatric neurologist, perhaps in Australia, to deal with some very specific types of pediatric brain tumors. Beyond that, we're really just getting started in our relationship with the Australian friends, and we're definitely open and excited. I hope that I've really enjoyed interacting with Amanda in preparation for this, and I hope that our relationship keeps going forward professionally. So, we're always open to those types of collaborations.
Let's have a look. So we've got, some words of encouragement from Nicole.
Thank you. And Alana sent me another question. She says, what are some of the areas of oncology that we've dealt with? And what progressions do we see with early detection of ovarian cancer? So some of my early work at the Institute was in breast cancer. And it's mentioned in that video, and I recommend looking for that video on YouTube about the Institute. You can really see a lot there about what we do. But without getting too technical, the way the Institute is approaching personalized oncology is by working with live tumor tissue and using that to grow essentially mini tumors in the lab that can be used to predict and test specific drugs that may work for an individual patient, meaning a patient undergoes surgery to remove a tumor. That tissue comes immediately to us and is then processed and grown and used to predict and test specific drugs. So my early work was with breast cancer tissue, where I worked on how to grow it and culture it in the lab. And I know that the personalized oncology team now has worked with ovarian cancer and I believe also uterine cancer. So again, we are sort of trying to do everything at once, but in a controlled and orderly fashion. And regarding early detection of ovarian cancer, so we're not there yet, but it's absolutely, I would say, one of the most urgent topics. We read about it a lot, we talk about it a lot here at the Institute, and I'm definitely looking for it to be one of our first really thorough menstrual blood projects, because it's clear that it's just absolutely urgent need for women's health care. Any more questions?
Yeah. If there are no further questions, I'd like to thank Raichel for conveying your vision, and for also discussing with us the really remarkably creative projects that you're doing that, for me as a clinician, really speak to what's important right now. And what people need right now is to be listened to and to have their stories told, and then to be conveyed in a way that's understandable and relatable, so that, there's this bridge between, our science and our understanding, which has been sort of lacking for so long. So, we really appreciate your time and your expertise.
Thank you so much.
We have a comment from Tina, who's a retired massage therapist and nurse, and thanking us. Yeah. And so I guess, yes, Tina, we, as a massage therapist, and, you would be hearing huge numbers of stories from women. And yeah, part of your project, Raichel, of tapping into the other health professionals will be wonderful. So I might hand back to Danny to close for the evening.
Okay.
And
Thanks.
Raichel, have a great day.
Thank you.
Thanks, Amanda, and thanks, Raichel. And we've got a couple of minutes, and we thought that perhaps Yael would like to say a little bit of, say something about her collaboration with Monash University. Yael, can we find you? Can you unmute yourself?
Okay. Hi. So when they asked about collaborations with Australian research institutions, so there's a Dr. Michael Gordon, who's a neurosurgeon in Monash University in Australia. And he was in Israel. We sat down and we had a really great conversation about collaborating in a project. As Raichel mentioned, I'm part of the personalized oncology project where we can take tumor tissue and grow it in the lab to be able to test which treatment will be most effective. And he spoke about a very specific type of tumor called vestibular schwannomas, which is not a malignant tumor. It's not cancer, but it grows in the skull in between the brain and the ear. And what's complicated about this type of tumor is that because it grows in that space, obviously all the real estate in that area is very important. So if you have a mass in between the brain and the ear that's growing, it can interfere with the nerves and the brain. It can put a lot of pressure on the brain. And what happens is that this tumor puts pressure on the brain and can affect the brain, and can also put pressure on the vestibular cochlear nerve, which is the nerve that is responsible for hearing and for balance, and it can cause deafness or it can cause dizziness and vertigo. So we are currently working out the logistics to collaborate with Dr. Michael Gordon and Monash University and use our system here of growing tissue and trying to personalize the treatment, because right now the only treatment for vestibular schwannomas is surgery. And when you do surgery in such a delicate region, you could often remove the tumor but cause damage to the nerves in that area. So that's the collaboration that I loved how he put it. He's a surgeon, and he said, my desire is to put myself out of business. I want to stop doing surgery on these vestibular schwannomas. I want to be able to treat them with medicine, and I want to take away all my clients. So maybe we could try and discover which treatment will be best using our system. And that's a current collaboration we have now with Monash University, finding the right partners in Israel. We have Hadassah's interested in Asuta and Beilinson, so we're talking to a number of doctors in Israel too.
Thank you very much, Yael, and thanks for mentioning Michael Gordon's name. And now I'd like to call on the Vice President of the University's Development Office, Adrian Traeger, who's found himself in Tel Aviv while this is going on. So Adrian, can you say a few concluding words about what we're trying to do?
Firstly, I'd like to thank the Australian friends of our university very much for putting this webinar together, both the Melbourne and the Sydney board, also the COA, Wizard, B'nai Brit, Women's Power, AJA, Australian Jewish Medical Federation, Mizrachi Australia, who partnered with us to bring this to everybody. Thank you. And of course, I want to thank all the participants who joined us. Without you, nothing would happen, and we appreciate it. We'd like to invite all of you to visit us in the Ariel University. And anybody who wants to know more about the university can reach out to Danny Lamb in Melbourne or Paul Naden in Sydney. They'll be happy. They're wonderful people and be happy to help out. What I'd just like one thing to say is that our university has a vision, and the vision is to be either the best or the second best in anything we do, or unique. And I think the personalized medicine department, and specifically Women's Health Center, is a very perfect example of that. We really breaking ground here. Raichel and Yael and the team are visionaries. They managed to identify and bring to light an issue that no one was touching. And I think what they're doing for world health, women's health, and health in other areas is really inspirational. We got very excited about it. So we'd love to let everybody welcome to the university and show you what's happening in the university on all the innovative things that are happening. And just look forward also to having you join us on many, many more webinars to come. And thank you, Danny. I want to thank Raichel for the talk, and Amanda, you were wonderful. You brought so much energy to your questions. Thank you so much, and goodbye to everybody.
Thank you very much. And Adrian, this can be found on our website at some stage, this webinar. We'll be able to place it there?
Yes, we'll put it on YouTube, we'll put it onto webinar, onto website, and we will email the link to everybody who was here. They'll have access to it.
Thank you very much. All right, everybody. Raichel, Yael, Amanda, Paul, Ilana, and Adrian, Erev Tov to everybody, and wishing you all a Shabbat Shalom. Bye.